Yeah, thank you. Thank you,
Oh, you've got them.
Claire.
Okay.
I've got them now, yeah, thank you. Just to sort of say before everyone starts to leave, that was the original, the title that Claire's just put up was the old title of this presentation. So we're
Sorry.
now, no problem, just thinking if people start pressing their buttons like take me out, they're all leaving. So actually what I'm going to be talking about is an exploration of the benefits and challenges of collaborative working within a knowledge exchange framework, but I am going to touch on the project that Claire mentioned in the title. So so thank you ever so much for coming along to this webinar. As Claire said, I'm a research fellow in public health section of ScHARR and the KE champion for section of public health. So in this webinar, I just want to give you a brief, I was going to give a brief background about what my role entails, but Claire's already done that, so I'll not do that again. I'm going to talk a little bit about the knowledge exchange framework and undertaking consultancy in ScHARR, outline some of the projects I've been involved in and focus on a little bit on the current project, talk about the impact of COVID and finish with some advantages and disadvantages of undertaking knowledge exchange. So that's what we're going to be doing. I'm just going to move, oh wait a minute, sorry, I have to do it on the cursor, don't I? Okay, so Claire's already mentioned that I was my PhD. After my PhD, I spent 4 years in a primary care trust as a research lead, and I returned to the university in 2008 to work on a project using assistive technologies for people with congestive heart failure. And I also looked at the impact of the built environment in acute care for older people. I joined the section of public health in 2010 to manage the health inequalities theme of the South Yorkshire and the Yorkshire Humber Clark. So my role. So I've been the public health section's knowledge exchange champion since 2016, and I spent just over a year as lead for public sector consultancy in ScHARR in the school and 4 years as a faculty officer for innovation in the Faculty of Medicine, Dentistry and Health. So my role in KE involves I work closely with the KE team, raise the profile of KE in the section, look out for opportunities, so horizon scanning, building teams, assisting with costings, assisting with bid submissions or doing my own bid submissions, and I work on consultancy projects both as PI and as a researcher. So the value of knowledge exchange has been brought to the forefront following the 2021 launch of the Knowledge Exchange Framework, or the KEF, which puts knowledge exchange on the same footing as research and teaching excellence. It sits alongside the Teaching Excellence Framework and the Research Excellence Framework to form a holistic assessment of universities. The UK Research and Innovation definition of KEF is: the aim of the KEF is to increase efficiency and effectiveness in the use of public funding for knowledge exchange and to further a culture of continuous improvement in universities. It will allow universities to better understand and improve their own performance, as well as providing businesses and other users with more information to help them access the world-class knowledge and expertise that is embedded in higher education providers. So the launch of the KEF, the Knowledge Exchange Framework, and the emphasis placed on innovation as one of the university's 4 pillars, the other 2 alongside research, education and One University, has shone a light on the importance of delivering high quality knowledge exchange activities. ScHARR's KE work provides a route to impact, which is one of the 3 priorities under the innovation pillar, and it's an important income stream for the school, contributes to the university's achievements, and is as measured by the KEF. ScHARR's also achieved success within the institution as being named as one of 2 major centres in the university's knowledge exchange strategy, and the other centre is the AMRC, which is the Advanced Manufacturing Research Centre. So a little bit about KE in ScHARR. So ScHARR has an annual KE income target, which is set by the Dean and agreed with the Director of KE. And the target set for the 2021-2022 financial year was 1.75 million. So this target is set by the Dean and the Director of KE. So the income target is apportioned across the sections, and it's based on a number of factors, which includes the average KE income over the previous 5 years, takes into account bumper years where we had a lot of activity, staffing capacity at the time, active staff carrying out knowledge exchange, and wider stakeholder issues such as recently we had the dispersion of Public Health England into OHID, and also scope creep for projects caused by the COVID-19 pandemic. So this year, the public health income target is 16% of the total ScHARR target, and it's £280,000. So in addition, each section is expected to contribute to ScHARR central costs, and this is used to pay for externally funded professional services staff who facilitate across all sections of the school. And these include the academic support office, the finance, IT, reception, HR, library, personal assistants, and KE staff. So there are various ways that people can spend this consultancy money. People use it to fund staff, to bridge staff who are maybe who are coming to the end of their contracts. Some people buy equipment with it, such as laptops. I've got a very nice laptop out of my income, and going to conferences, etc. So we're very lucky in ScHARR. I keep pressing the wrong button to move myself on, I'm sorry. We're very lucky in ScHARR to have great support from a small but perfectly formed and amazing KE team. So we've got Vanessa Wright is the business manager, Steph Bryson and Hannah Merton are the KE procurement leads, and our director of innovation is Professor John Brazier, and the deputy director is Dr. Katie Cooper. So they make our job a lot easier by leading us through the minefield, which is the contracting and the invoicing and the costings when we first go into, going for a new opportunity, and they stay involved throughout the projects and they leave us to get on with the work, basically. So it gives confidence to the clients that there is a team in the background supporting this function. So in addition to me in public health, there's a section representative for each of the sections. So we've got Steve Harris in health services research, Matt Franklin in health economics and decision science, so heads, and design trials and statistics. Our lead is Danny Hind. In ScHARR, we've also got a professional learning team, which was formerly called the Short Courses Unit, and this is headed up by Anthea Sutton and supported by Karen Holden. So we've got a small but perfectly formed team, and they're a joy to work with. Just a quick visual then, just really about the opportunity to project support throughout. So as I said earlier, the team can support us with the opportunity qualification. So are we going to take the opportunity forward, or are we going to qualify it out if it's not something that we want to take up or we haven't got the capacity to do? They assist us with the proposal development and the support of that proposal. They give us financial support, so they help with the costings, to make sure that we are costing the project appropriately. They help us with the contracting support, and they also help with project support throughout the duration of the project, which is actually nice because they see it through with us from start to finish, and that is really helpful. So I just want to go on to talk a little bit about the knowledge exchange projects that I've undertaken over the last few years, both, as I said earlier, leading projects as PI and also as a researcher. So I'm currently working on the Yorkshire Cancer Research funded project, which is evaluating the role of the Cancer Screening and Awareness Coordinators programme in Leeds. They're people who, it's about breast cancer, cervical cancer screening and bowel cancer screening. So that's a project that we've been running for a couple of years, and that's due to end at the end of this year. Prior to that, undertook quite a large piece of work for the British Red Cross working on evaluating their community connectors program, and that's where they were enabling socially isolated and lonely adults from various groups, from people with young children right through to elderly people or people whose children had left home due to go to university, empty nesters, etc. And that was enabling people to reconnect with their community. Done quite a lot of work for Crew's bereavement care, so that's been three projects for Crew's bereavement care. The You Behind the Uniform project evaluation was where they trained veterans in bereavement care to support bereaved colleagues. Then the military project. Sorry, no, You Behind the Uniform was emergency care workers, so frontline staff such as police, ambulance, fire service, that was supporting them to support their workers with bereavement care. The military project was with veterans trained to support colleagues who'd gone through bereavement, and the More Than Words evaluation were looking at the impact of social groups for bereaved people. Totally differently, did some very small amount of work for Roche products, and that was looking at patients' perspectives of the impact of geographic atrophy. So that's macular degeneration leading to the loss of central vision. So we did some workshops, focus groups with people suffering from geographic atrophy. Worked on an evaluation of a Sheffield initiative from a centre in Sheffield, evaluation of the Time Builders initiative. This was a really interesting project, and this is where people receive time credits for doing things such as litter picking or working in a community garden, and they earn credits for that they can then add the credits up, and they can exchange these credits for meals, for theatre tickets, football matches. So there were various partners across Sheffield part of the scheme, such as like the 2 football clubs, etc. And that was a really interesting work. Done quite a lot of work with Doncaster Council. I was involved in their supporting and maintaining independence programme evaluation. I think that was the very first piece of work that I ever did as a KE project, and that was involved in tracking the impacts and outcomes of patients that are discharged from hospital. And then the second one I think I got involved with was the Stoke Council one, and that was evaluation of their cooperative working model. And that was where agencies across the borough worked together to deliver joined up solutions for families and individuals with multiple and complex problems. So it was like a one-stop shop. So people didn't have to go here to deal with the police, deal with the social. So they were all linked together. So that was all very, very interesting. So that's a bit of a whistle-stop tour of my KE projects to date. I just want to now talk a little bit and reflect on my current knowledge exchange project. And this began in the height of the COVID pandemic. So we were all becoming very well versed in using Google Teams and other online platforms to conduct our research, KE and teaching activities. So the Preventing and Tackling Mental Ill Health Through Green Social Prescribing project is part of a 5.77 million cross-governmental initiative. And the contract to evaluate this project totaled just under 1.1 million and was awarded by DEFRA, so the Department for Environment, Food and Rural Affairs. And this project is running from March 2021 to June 2023. Its purpose is to look at how connecting people with nature can prevent and tackle mental ill health. And there's a varying amount of number of partners, including DEFRA. So we're working across the Department of Health and Social Care, Department for Levelling Up Housing and Communities, NHS England, NHS Improvement, Natural England, the Office for Health Improvement and Disparities, so formerly PHE, National Academy for Social Prescribing, NASP, and Sport England. So quite a lot of people there in the mix. There's the projects in evaluation is focused, our evaluation is focused on 7 test and learn sites, pilot sites across England. And these were commissioned by the programme to deliver green social prescribing within the communities hardest hit by coronavirus. So these could include those living in deprived areas, people with mental health conditions, Black and minority ethnic communities. And we've got 7 sites located, they've got 7 sites that are located across England. There's one in the Humber Coast and Vale, one in South Yorkshire Bassetlaw, one in Nottingham, one in Derbyshire, one in Greater Manchester, one in Surrey, and one in Bristol, North Somerset and South Gloucestershire. So this is the first ScHARR's first knowledge exchange project that was submitted as a consortium. So it's an excellent example of external partnership working as outlined in the knowledge exchange framework. So I'm PI on this University of Sheffield led evaluation, working with a consortium that comprises researchers from the University of Plymouth and Exeter and Sheffield Hallam University. So there's quite a lot of us, as I keep saying. Okay, so yeah, just a sec. I think I've said everything I want to say on that slide. Yeah, so just a quick introduction to green social prescribing, and there's a nice photograph there of one of my colleagues at her allotment working on digging some earth. So the social prescribing definition that we're using is the practice of supporting people to engage in nature-based interventions and activities to improve their mental health. Social prescribing link workers and other trusted professionals in allied roles, connect people to community groups and agencies for practical and emotional support based on a what matters to you conversation. Also to say we're doing green social prescribing and blue social prescribing, so there are sort of lakes activities, canals, rivers, so it's green and blue social prescribing. So that's our definition. So I'm just trying to move on. The aims of the project are to understand the different systems, actors and processes in each of the test and learn sites and how these impact on access to and potential mental health benefit from green social prescribing. To understand system enablers and barriers to improving access to GSP, particularly for underserved communities. Understand how green social prescribing is targeted at particular groups, including underserved communities. And to improve understanding of how to successfully embed green social prescribing within delivery and the wider social prescribing policy landscape, and to understand the key pragmatic and achievable leverage points to enable and sustain green social prescribing further than the programme, so ahead in the future. So just a quick slide on our evaluation design. So it's iterative and developmental as we go along. So we're feeding back results as we go along to the partners. We're using a flexible mixed methods approach. So we're looking at qualitative and quantitative methods. It's a realist informed evaluation. So what works for who in what circumstances and why. And we have got 7 very different test and learn sites. So we're having to look at those across all the different circumstances for how those are working, and then try to bring it together at the end into a sort of joined up across all 7. We're using an embedded researcher model. So this is where we can place a researcher virtually in each site. So the researcher may go to the sites and have a look at some of the activities that are going on. But they're embedded in each site to be able to fully understand the workings of that particular site. So then they can amalgamate the findings to provide a cross-site analysis. The project is being delivered within 7 interlinked work packages. So we have a scoping phase that we've completed. That was work package 1. We've got an evidence synthesis work package, the mixed methods evaluation of the test and learn sites themselves, a light touch evaluation outside the pilot sites. So that's looking at sites that didn't receive the funding for the test and learn sites, the test and learn site funding. We're looking at partnership working at a national level. As I mentioned before, we've got a lot of partners involved in this particular project. So it's been very interesting to try and sort of work with them to see how they all work together and how it all fits together for them. We've got a value for money work package, and the final work package will be the integration of work packages and our dissemination. Okay, thank you. So just a little bit about the challenges presented by COVID. So team building, it made team building more challenging. I'd previously worked with colleagues from Sheffield Hallam, and a number of people in the team had links with the universities of Exeter and Plymouth, but it really all sort of came together as a fairly new thing, even down to sort of the who was going to lead this particular piece of work. So we assembled a team of experts for this project, and as we thought we would be stronger to deliver this project as a consortium rather than try to bid for it individually. We've got a team of people around of 18 people in this project, so that's just the evaluation team, not the national partners and the partnership organisations. So we've been unable to have face-to-face meetings, but it did make getting to know people, a lot more trickier. We are aiming to get together in June. We were aiming for before Christmas, but we didn't get there. Things like interviews and workshops online, we all know where I'm coming from here. Internet issues, oh, you're on mute, oh, my internet's down, you've frozen. Children coming into the room, barking dogs, postmen, we've had it all, but we've worked through it, and I think everyone's become really good at that type of working, that type of online working. The flip side is it's easier to get hold of people, so not having to travel to workshops, interviews, and it enabled a more flexible working, so more flexible working patterns. It did have an impact, not particular this project, but projects generally has had an impact on other planned work. So, for example, if you'd had projects that were affected by COVID, you'd have to stop that program, and then it causes a knock-on effect for the other projects they're involved in. For example, on the cancer research one, there was no screening, cervical, breast or bowel screening going on during the pandemic, so we did have to sort of wait for that to start before we could start up the evaluation again. So I now just want to talk a little bit about the advantages and disadvantages of undertaking consultancy generally. So this is really based on my experience and other colleagues' experience who've undertaken KE across a number of projects. And I'm going to start with the disadvantages, and I'll show you why in a minute when I've gone through my disadvantage slide. So yeah, so you are competing with the big hitters. So there's the consultancy companies will tend to go for some of the bigger contracts, or some of the contracts generally. You are sort of dealing with, there's academics that has maybe got a track record of working with those particular companies, but they do have to put out to tender, so they will have to put out to three tender, maybe shortlist 3 and interview 3, although they may actually know who they want to give the contract to. So sometimes it doesn't always seem a particularly fair process. Anecdotally, we bid for 3, and we went for the first one, and we saw that the teams that were there, and then for the same contract with the same people, we went to a second interview, and the team that we knew had got it the first time, they were there at the second interview, and I think it was just a sort of a I'll get my coat moment, where we just thought they're going to get it, and they did. So there's that. Colleagues can lack capacity to undertake knowledge exchange projects, and it can rely on goodwill of people doing being approached all the time. And if people leave, the pool of KE interested staff can diminish. It can compete with existing workloads and full-time equivalent contracts. So, for example, it's very easy to become overcommitted. So, if you use consultancy as a source of your source of income for your salary, you can become overcommitted if you win. Say if you put 3 in and you win all 3, it's almost like speculate to accumulate, but if you're not careful, you can end up overcommitted. You don't always get all the projects that you put in for either, so it's a little bit sort of, you've got to weigh that up, so that can sometimes be a bit tricky. Just a little bit about the value of the KE pound compared to the research pound and its equivalence, where it's maybe not recognised as good income, if you like, on equivalent to a research pound income. Sorry, that's a fire alarm. I don't know if everyone can. I'll just pause. Okay, thanks. So yeah, so when it comes to promotion applications, etc., but now with the introduction of the knowledge exchange framework, this and work that's going on in the university, this is becoming more and more recognised, and hopefully will be resolved. So some of the projects are very small scale, and we qualify them out as they're not particularly financially viable. So people may have only about, say, 30,000 to evaluate something that they want evaluating over a 3-year period. And when you're costing in staff to do that work, it's not always financially viable to do it. But this can actually be seen as some people take those on if, for example, they want to build up a track record with a particular company. So, you know, you may think it's a very small piece of work, but that will come off the back of that is actually something that could be very, very sort of lucrative in the future. Unrealistic deadlines for submission of the application. So sometimes we get an opportunity through, and the deadline to get the entire bid into the client is something like 10 days. I think we've done a 7-day one. It's very stressful, but we've done it, and we've done it, and this is where we draw on our excellent KE team. We have gone for several with short deadlines, and we have got there, but it's not just about writing the proposal, it's getting the costings in, it's getting all the you know, the contracting in place with the university before we can actually even tender for that. Often we get demanding clients that have competing thoughts and opinions. So you do feel sometimes like you're answering to multiple masters, if you like. So that's something to take into consideration. Also, you may get that generally the clients don't want to hear the negative findings. Obviously, they want to show their initiative in the best light possible, and that's understandable. But sometimes they particularly need information or evidence that's not always possible to collect. For example, it can impact on publications where the funder may not want you to publish negative findings, but we have negotiated around that. But that's something to bear in mind. Scope creep, so the wanting more than you agreed to deliver. One of my colleagues said they want their pound of flesh, and I think that's something that we've had to deal with. So some expectation management is needed. You know, looking at what's in the contract and what's in the proposal. There can be very, very much moving goalposts, but it is important to negotiate your way around that. And then getting the money in. So with the research monies, that comes in as part of the grant, but in KE, deliverables are very much tied to outputs, and clients can hold this over you. So even though it may be their delays that have affected your timescales, they could say, well, you know, we're not paying you on that until this report is exactly like we would, you know, want it. So that can sometimes be it can be very frustrating, and it is. So that's the disadvantages. Now, this is why I wanted to put the disadvantages first, because I could put this slide in then, and I'm sort of sticking with nature a little bit, because I do think we should all look at hills, and I'm keeping the green theme. So before you run to the hills, I want to talk to you about the advantages and the very positive aspects of doing knowledge exchange. And I also wanted the positives to be the sort of the take-home message for this webinar. That's taken in Castleton, if anyone's interested. Okay, so the advantages, it is very rewarding. There are negatives, but that does outweigh. And I think we're very lucky in ScHARR. We have the amazing KE team, and they do make your work a lot easier. You're not feeling like you have to deal with it on your own. It enhances your CV, so the university is increasingly recognising the value of knowledge exchange with the KEF and the innovation pillar. And also the university is developing the innovation academic career pathway to sit alongside the teaching and research pathway, research specialist and teaching specialist pathway. So this will be important for staff in other parts of the university whose work mainly involves knowledge exchange. A good route, a route to promotion. you get to work with new people. We've worked with, I've worked quite a lot with the people from the Health Sciences School. So we're taking on bids that we can do as a joint venture, and that enables us to utilise the departmental strengths from those particular colleagues as well. It also enables departments that don't have such a well-developed knowledge exchange structure to be involved in consultancy. It helps you develop a new skill set. As I mentioned in the negatives, it seems very different to working on a research funded project. The relationship you have with the client, for example, is different to that of a funding body. It is far more hands-on, collaborative and negotiation based. It does raise your profile and leads to further opportunities. For example, the cruise work came off the back of the British Red Cross project, so we were recommended by the Red Cross to do work for cruise. It is it influences policy decisions. It's close to practice. It can directly influence policy and future funding decisions. So whether or not to continue a service, the best ways to take it forward, etc. And ScHARR is the biggest provider of advice to policymakers. They're very fast turnaround and varied, so that really appeals to me. I like that, the fast turnaround and the variety of work that I've been involved in, such as I was mentioning, you know, the work with the with Roche products, the Red Cross, they all sort of use the same set of skills, but they are all very, very different projects and varied. So publications are achievable, but you do have to bear in mind that the funders' timescales may affect when you're able to publish. Also stated in the disadvantages that the funder might not be comfortable with hearing the negatives, so be reluctant really to have, you know, to agree to publication. But we managed it, and there's two very nice papers that came out of the British Red Cross project. So mixed methods evaluation, we published that, and we also published the qualitative evaluation of the qualitative work that was involved within that presentation. So that's me, I've finished. So another chance to look at a really nice picture. This one's the Lake District, and if we can pause for thoughts and questions. Thank you.
Okay, thanks for that, Annette.
No worries.
Hopefully you can hear me again.
I can.
So yeah, open to questions now. Has anybody got any questions for Annette? Like I said before, you can type them into the chat box, or you
hands up.
Can switch your microphone.
Yeah, we've got some hands up, Angie. Slides available, yes.
Okay, I'm just looking through the list, but I think if anybody put their hand up, they must have put it down.
All right, I still see two hands raised, but Gemma asked if the slides would be available, and yes. And your mics are enabled, so please feel free to shout out. Yeah, don't be shy. Do you know, that is such a beautiful picture, isn't it?
Yes, I was just going to say how lovely that is.
One of our research team from Exeter took that photograph.
Oh, really?
In the Lake District, yeah. Yeah. I think I want to be there.
Yeah. Oh, I want to be there now, definitely. Definitely. On a lovely day. It is actually sunny here in Sheffield, I should stress, but it's not quite. Oh, Duncan, have you got a question?
Hi, Duncan.
Hi. Yeah, I was just. Can you hear me? Okay.
Yeah.
Yeah, we can.
I was interested in understanding a little bit more about how you linked these activities to the KEF and the extent to which understanding what the KEF was asking us to do would lead to us prioritizing what we do.
Oh, that's a good one. I don't think that's one for me though. I think that's maybe more one for our for John, our director of KE. It's just to me that it all links in with the, you know, with the strategy, and it's all becoming sort of more knowledge exchanges is coming to the forefront a lot more. So it's really having these documents and all this where you're actually judged on your KE as well as your research and your teaching, that, you know, it's got to be good, hasn't it? Sort of it's raising that awareness. I don't actually know the ins and outs of the knowledge exchange framework.
Okay, I can see a question from Susan who says, really interesting, Annette. Question, you talked about scope slip. Any tips to manage this?
Oh, crikey. I suppose it's about being able to identify your, your times, work with the funder really to work out your timescales and what's achievable between the, to be able to be taken forward. I mean, some for one, I can't really think. Hang on, scope slip. Negotiation really. There's bound to be other stuff as well.
Okay, Jenny.
I'll have a think and let you know.
Okay, Jenny, you've got your hand raised. Do you want to ask a question?
Hey, yeah, so I found it really interesting your comment about competing with like big players like consultancies. And I just wondered what you thought the advantages of like a collaboration between academics offers versus consultancies.
Yeah, I think there's quite a lot of benefits. I think you're getting sort of people that are experts in that particular field. So, for example, for the DEFRA project for the evaluation, we've assembled a team of experts that know about the green social prescribing agenda and the methodologies that we use as sort of rigorous. I think I think that there's benefits in using a university team, unless you're sort of just maybe doing a survey or you just want to sort of look at a large population survey or something. That answers your question.
Okay. Okay, thanks for that, Annette.
All right, no worries.
Any more questions?
What's that mean? Eligibility for the entrance? Victoria's question.
Can you clarify that for us, Victoria, in the chat? I apologise.
But yes, Susan, I think it is about relationships.
All right. Any eligibility for enrolling the KE?
I'm not sure.
I'm not quite sure what you mean by that.
Do you want to open your mic, Victoria, and explain? Oh, thank you, Catherine.
All right. Okay.
I'm not quite sure what you mean, Victoria, but if I've got my email address that could send to you, and we could have a chat, if that helps.
Okay, well, we can always send that to you. Oh, no, I think we've got another question here.
Hi, Ellie.
Really useful question. I'm just wondering how you found the interview process for consultancy projects and whether there are any key differences between interviews for research projects or consultancy projects. It must be quite nerve-wracking interviewing directly with the client.
Yeah, it is. I can't really talk much about interviews for research projects because I don't think I've really been to many. But yeah, it can be very nerve-wracking. Sometimes they send you what they want, what they would like you to do, whether they want you to present, which members of the team they want you to bring. But sometimes they are rather vague, and we've turned up at consultancy interviews where we've had all the team present, and they've like, you've overkilled us with the team, we've got too many, and then you'd send 2 people from the team, and they're like, where's the rest of the team? So it is really it can be a bit difficult to work out quite what they want. I know a colleague recently went for an interview where they didn't mention a project, a presentation, but when they got there, they expected a presentation. So I think it's about they're all different. So I think you'd have to make. I think one of my key learning points would be if I went to another interview, I would be very much making sure I knew exactly what it is they wanted from us when we got there. you do try to ask, and it's, oh, you just come along with the team and, you know, and just have a chat. And I think you can get a bit put on the spot when you get there. So yeah, but they are all different. And sometimes you don't even have an interview. Right. Thank you.
Okay, thanks for that question, Lily.
Yeah,
Right,
some of them
okay.
are, you just get them through the, you go for the bid, and then they ask you a few questions, and you type back the questions to them, and then they decide. So, you know, you don't always have to go through a big interview process. Thanks. Sorry, I finished.
That's okay. Right, okay. Do we have any more questions before I close the session? What I will do, I'll just stop